Hi, welcome back. In this video, we will learn about expression of breast milk. Sometimes mothers may have to express her breast milk to feed the baby apart from directly breastfeeding the baby. In this video, we will learn about the various reasons why she has to do it and how to do it. So what are the reasons for expressing the breast milk and how to do expression of breast milk using her own hands, how to express breast milk using pump, and the pumps can be mechanical pump or electrical pump, how to store the expressed breast milk, and how to sterilize the storage containers and breast pumps. Now, what are the reasons for expression of breast milk? The first reason is in all conditions where the mother is unable to breastfeed her baby. If the baby is preterm, the gestational age is less than 37 weeks, or the weight is low, less than 2.6 kilo or 2.5 kilo, the baby may need to be breastfed, followed by feeding the baby with the expressed breast milk. If the baby is sick due to some reason, for example, the baby has perinatal asphyxia or other reasons where the baby is having breathing difficulty, in that case, the baby cannot directly feed the mother. The mother has to express her milk and give to the baby every 2 to 3 hourly from the labor room, or wherever she is admitted, or maybe she is at her home. She has to express the milk every 2 to 3 hourly and bring to the NICU where the baby is admitted. Thirdly, in babies with a severe cleft palate, where the baby is not able to produce enough negative suction pressure to draw milk from the breast, she will have to express the milk and give by some feeding utensil, maybe some bottles. Fourthly, breast problems where it is very painful, severe painful breast problems like a sore nipple, where the mother is not at all able to feed directly, or if the breast is engorged with a lot of milk, or if the breast is infected, mastitis and breast abscess, where there is abscess in the breast. In case of infections and the breast abscess, the milk may be contaminated by bacteria. In those cases, the mother has to express the milk and discard instead of feeding the baby. However, she can feed directly and followed by expressing her milk from the other normal breast. I have repeated breast engorgement once again as a reason for expressing breast milk because breast engorgement is a condition where there is accumulation of the milk above what the baby can directly suck from the breast. So the mother has to express her milk every 2 to 3 hourly, at least 4 to 5 times at night, so that she can have less pain and the breast becomes softer and her pain and tenderness reduces. And in case of sick mothers who have some problems like respiratory or breathing difficulty or cardiac problem, mother may be oxygen dependent, where you can use a pump and get the milk expressed from her breast and every 2 to 3 hourly and give to the baby. Now, as I already said, the breast milk expression can be done by hand or by a pump. Now we will learn about how to express breast milk using hand. Now, hand expression involves massaging your breast with your hands and fingers to stimulate the release of milk. You can start hand expressing either before or after you have your baby. And why hand express? To collect colostrum, to collect the milk, to increase your supply of breast milk, and to relieve hard or engorged breast. How do I get started? Wash your hands. Yes, before expressing the milk, it's very important to wash your hands with soap and water, and then pick a relaxed spot, sit comfortably and try leaning forward. Follow the instructions in the diagram, which we will go through, And it may take a few compressions before you start to see drops of milk, and the expressed volume of milk may also vary, but gradually it will increase. Shorter and frequent sessions of up to 30 minutes are the most effective. So basically, there are four steps. The step number one is to gently massage the breast, starting at the top of your breast and move your hand down towards the nipple. You can even make a fist of your hand. Suppose you are admitted in the labor room, your hand may have IV cannula. If both hands have IV cannula, you can get one of them removed, and using the hand without the IV cannula, you can form a fist with the knuckles facing towards the nipple. And imagine that you are taking a paste from the toothpaste, which has got almost empty. You are pushing the paste from the tail towards the mouth. So similarly, in the breast, the mouth area is near the areola and nipple, and the tail area is towards the periphery. And many tail area of the milk secreting glands are in the axilla also. So you can form a fist and shave or press the milk towards the center, so that you can do it from all sides. And the step two is to hold the breast like a C shape, placing your thumb and fingers 1 to 2 inches away from the nipple on both sides, on opposite sides. And step three is push back towards your chest. Keep your thumb and fingers cupped in a C shape around the nipple. So if you want to express the milk, you should not just press the hand or the breast like this. You have to move your hand towards the chest, and without releasing the pressure, you have to press it towards the center also. That is the fourth step. So express the milk. Bring your thumb and fingers together towards the center and slide forward, but not on the areola. You should not press on the areola. Press and compress and release. Repeat again and again. And to store the milk, you can collect the milk in a stainless steel container, and you can seal and label the container with the date it was expressed, and store in the fridge for up to 4 days, and in a deep freezer for up to 12 months. So again, I am repeating the same procedure using a different diagram. So you can wash your hands with soap and water, dry them well. Yes, drying is also important. Find a comfortable private place. Have a glass of water handy. Think about your baby, as it can help to stimulate the letdown and help the milk to start to follow. Then massage the breast, support the breast from below and massage the breast, and push the milk from the periphery to the center, and hold the breast in a C-shaped manner, and gently press the thumb and forefinger back towards the chest into the breast tissue, and then press the thumb and forefinger towards each other to compress the ducts and help move the milk out of the breast. Use a clean, sterilized container or bowl or bottle to collect your breast milk. So same picture, you can change the position of your hand. The C-shaped hold can be done from below or from the opposite side, and again press the thumb and the fingers towards the chest into the breast tissue, and then press the thumb and forefinger towards each other to compress the duct and help move the milk out of the nipple, and use a clean sterilized container or a bottle or a bowl to collect your milk. So there are basically 4 steps, and you have to change the direction from below and from opposite side, and do the 4 steps again and again so that the milk comes out. But before that, you should have the container, which is better a stainless steel container, because it is free of any carcinogenic pollutants, and you can sterilize it by washing the stainless steel container with soap and water, then washing with a warm water, and then boiling it so keep it submerged in boiling water for around 15 minutes, and then drying it. For drying, just you have to shake the bowl, and you should not keep it inverted. You can keep it everted, and you should not wipe the container with a cloth, because the cloth may have bacteria. So you do not want to contaminate your stainless steel container. Again, wash your hands with soap and water. Place a clean container below your breast to collect the milk. as I have already told you, step 1 is massage your breast. Step 2 is to hold the breast like a C-shaped manner. And step 3 is to press backward towards your chest. And then step 4 is gently squeeze forward after backward pressing so that the milk comes out. And then you have to repeat it again and again at different positions around the areola. So now you have understood hand expression. Now hand expression of breast milk is very good if there is engorgement of breast. When there is engorgement, the breast is all tight and painful. And if you use breast pump during this situation, you may damage the skin. So in breast engorgement, the hand expression is better than using the pump. Now let's learn how to express the milk using the breast pump. So again, you have to sterilize. You have to disassemble the various parts of the breast pump and sterilize. That means you have to do 3 steps. First is washing with soap and water, then wash with warm water, which is basically boiled water, which has cooled down. It has become warm. You have to wash the breast pump using that warm water. And thirdly, submerge the breast pump in boiling water for 15 minutes. After that, you dry it, and after that, you are preparing for pumping the milk out using the breast pump. So wash your hands again, dry it well, wash and sterilize and assemble the pump, and have a trial run, practice using it, and start with low suction. Don't go for very high suction because pain will reduce breast milk. So you don't want to cause pain while expressing milk. Start with low suction and then slowly increase. And try expressing from one breast for at least 30 minutes and then from the other side, or at least 15 to 20 minutes from one side and then to the another side. And while expressing the milk using pump, you can also feed the baby from the other side. That will let down more milk from the side where you are using the pump. So you can use a manual pump where you are doing the pumping, or you can use an electrical pump. An electrical pump can be a one-sided type and a two-sided type is also there, where you can pump from both your breast simultaneously. So this is a manual pump and this is a electrical pump. So electrical pump has a motor, and this motor should not be washed. It should be always kept dry. The other parts can be disassembled, sterilized by washing in soap and water and then warm water and then submerging in boiled water for 15 minutes, or you can do a steam sterilization where there is a steam sterilizer and you can sterilize the container in a steam sterilizer for at least 6 minutes. And if it's an electrical pump, there is something called a valve inside which you can place it loosely, and the compressor or the motor, you can adjust the pressure, increase the pressure slowly from 1, 2, 3, whichever level is available. But you should never go for maximum pressure because maximum pressure causes pain and pain reduces milk. And also there is a timer in the compressor which shows how much time you have taken for pumping the milk. And the timer, you can pump the milk for at least 22 or 15 to 20 minutes from each side. Now coming to the storage, how will you store the breast milk? You can store using storage bags, or you can use a stainless steel container. Stainless steel container is good because it is free of any pollutants, and you have to sterilize a stainless steel container. And what is the temperature where you can store the milk? So if you are using a cooler, you can store up to 4 hours. Or if you are using a refrigerator, you can store up to 4 days. And if you are using a deep freezer, you can store up to 12 months. Now, if you have thawed a previously frozen milk, thawing means deep freezing the milk. Then you can store up to 1 to 2 hours in a cooler and up to 1 day in a refrigerator. and never refreeze the thawed milk. And if there is a leftover milk from a feeding, you have to use it within 2 hours after the baby is finished feeding. And always label the milk with the date it was expressed and the child's name if delivered to a child care facility. And freeze the milk in small amount so as to avoid wasting any milk. Store the milk in the back of the refrigerator or freezer and not near the door. If you don't plan to use freshly expressed milk within 4 days, freeze it right away in the deep freezer. Milk can be stored in an insulated cooler bag with frozen ice bag, which is called a cooler, for up to 24 hours when you are traveling. So that is useful when you are traveling. Now, so at room temperature, a milk may remain stable for 4 hours. Inside a cooler bag, it will remain stable, which has ice packs around it. It may remain stable for 24 hours. In a fridge, it will remain stable for 4 days. And in a deep freezer, it will remain stable for 12 months. Now, thawing. Always thaw the oldest milk first. So, always deep freeze the oldest milk. Thaw the milk under lukewarm running water in a container of lukewarm water or overnight in the refrigerator. So, never thaw or heat milk in a microwave. So, because microwave destroys nutrients and creates hot spot which can burn a baby's mouth. Use milk within 24 hours of thawing in the refrigerator. That is from the time it is completely thawed and not from the time when you took it out of the freezer. Use a thawed milk within 2 hours of bringing to room temperature or warming, and never refreeze a thawed milk. Now the feeding. Milk can be served at room temperature or lukewarm. To heat milk, place the sealed container into a bowl of warm water or hold under warm running water. Do not heat milk directly on the stove or in the microwave. Test the temperature before feeding it to your baby by putting a few drops on your wrist. It should feel warm and not hot. Swirl the milk to mix the fat which may have separated. If your baby did not finish, then leftover milk should be used within 2 hours. Now cleaning. So you have to clean the feeding utensil, you have to clean the storage utensil, and you have to clean the pumps. You can disassemble the feeding parts and the pump in a clean basin with soap and water. Do not wash directly in the sink because germs in the sink could contaminate items. Now rinse throughout under running water. Now air dry the items on a clean dish towel or avoid paper towel. Even towel, avoid using wiping with a towel. You should only do air dry because you don't want to contaminate the containers. And also rinse with warm water instead of tap water. And use clean hands and dry the items in a clean protected area. For extra germ removal, sanitize the feeding items daily using one of the methods. So clean the container with a dishwasher using hot water and then wash it with warm water and boil it in water for 15 minutes or in a steam sterilizer for around 6 minutes. So thank you for your patient listening. We have learned about expression of breast milk and how to store it and how to sterilize the feeding utensils and the breast pumps.